Hello everyone, I'm Dr. Adam Maulana. How are you today? I hope you and your family are always blessed with good health, happiness, and protection in all your daily activities. Thank you for joining me once again for another educational health video. Today, we're going to discuss an ENT surgical procedure that many people may have heard of but don't fully understand: mastoidectomy. Although the name may sound complicated, understanding this procedure can help you recognize when it may be necessary and why it plays an important role in preserving ear health. Behind each ear is a bone called the mastoid bone. Unlike a solid bone, the mastoid contains many small air-filled spaces that resemble a honeycomb. These air cells are connected to the middle ear and help regulate air pressure while supporting the normal function of the ear. Because the mastoid bone is closely connected to the middle ear, long-standing middle ear problems may eventually affect the mastoid as well. A mastoidectomy is a surgical procedure performed by an ear, nose, and throat ENT specialist to remove unhealthy tissue from the mastoid bone. The primary goal of this operation is not simply to perform surgery, but to eliminate the source of the problem, protect the surrounding ear structures, and preserve hearing as much as possible. This procedure is usually recommended when medications or other conservative treatments are no longer effective, or when certain conditions require surgical management. One of the most common reasons is the presence of a cholesteatoma, an abnormal growth of skin tissue inside the middle ear. Over time, this tissue can continue to enlarge and gradually damage nearby bones if left untreated. Mastoidectomy may also be performed for long-term middle ear conditions that have affected the mastoid bone. Before surgery, the ENT specialist performs a thorough evaluation. This includes discussing the patient's symptoms, examining the ear with specialized instruments, conducting hearing tests, and, when necessary, obtaining imaging studies such as a CT scan. These evaluations help determine the extent of the condition and allow the doctor to select the most appropriate treatment plan. During the operation, the surgeon makes a small incision behind the ear. Using an operating microscope or endoscope along with highly specialized surgical instruments, the doctor carefully opens part of the mastoid bone and removes the unhealthy tissue. Every step of the procedure is performed with great precision to protect the important structures surrounding the ear. Once the affected tissue has been removed, the surgical area is carefully closed according to standard medical procedures. Following surgery, patients usually require several weeks for recovery. During this time, it is important to keep the ear clean and dry, avoid getting water inside the ear, and attend all scheduled follow-up appointments. Regular checkups allow the ENT specialist to monitor the healing process and evaluate hearing after the operation. Many patients ask whether their hearing will immediately return to normal after a mastoidectomy. The answer depends on each individual's condition. For some patients, hearing may improve after surgery. For others, the main objective is to stop further damage and preserve the remaining hearing rather than restore it completely. This is why early evaluation is so important whenever persistent ear problems develop. Never ignore ongoing ear symptoms. Your ears are essential not only for hearing but also for communication, balance, and enjoying everyday life. The earlier you consult an ENT specialist, the greater the opportunity to receive appropriate treatment before the condition becomes more complicated. Developing healthy ear care habits today is one of the best investments you can make to protect your hearing and maintain a better quality of life for years to come.